free clinics have stepped up during the pandemic. We've been innovative, cutting edge, doing whatever it is that we need to do to meet the need. Some of that is technology-based, some of that is staff-based, training our staff in trauma-informed care, adding behavioral health services, expanding dental services. Telehealth has been huge. So constantly taking a look at how we can serve the community better in response to this pandemic, and I think broadening some of our partnerships.
It was amazing how free clinics really, we banded together and communicated with each other. How are you doing this, and how are you able to still see patients in your community? We worked very closely with the health departments as well, and that was a critical partnership throughout the pandemic.
Free clinics have always been there to fill in the gaps, and I think the pandemic really exposed some gaps in the healthcare system here in Virginia. And so the pandemic resulted in, first of all, an increase in need. So we had more people who lost their jobs and therefore their health insurance. We had more people who had health needs. We had folks who got COVID, who became ill, who were recovering or had long-term COVID. We also had folks that had delayed their care at the beginning of the pandemic, and therefore their chronic conditions had gotten worse. So by the time they came to us, their needs were even greater than before. So we had this tremendous need, and we still have about 600,000 Virginians who are without health insurance. And then on the other side was the lack of volunteers. We saw a reduction in the number of volunteers that were able to provide care to our patients during the pandemic. Many of us rely upon retired or semi-retired physicians, dentists, pharmacists, nurses to provide care for our patients. And many of them are older, and their own physicians were saying that they needed to stay at home or not expose themselves. So we had a loss of volunteers. Some of us had to fill in those gaps by paying providers, which is a huge expense that we have not traditionally had at most free clinics. We also had the increased costs of personal protective equipment, air circulation systems, changes in our facilities to create the safest possible environment during the pandemic. And so I think that we've partnered very deeply with local and state health departments to meet this increased need, to address some of the new services that are being required because of the pandemic, such as vaccination and testing, mass large-scale vaccination and testing. So I'm proud of what we've done during the pandemic, but it took a great effort, and it's not going away. So those changes and things that we need to do to create a safer environment from an infection control standpoint, those aren't changing. Our retired volunteers aren't returning to the volunteer pool. So we'll see the impact of the pandemic at free clinics for a very long time.
The pandemic has demonstrated the need for free clinics and the value of free clinics. But in order to be able to move forward, we need financial support. It's critical for free clinics to get their message out widely and broadly, to understand the mission of free clinics, to understand the impact of free clinics on the health of their community.
I think it's during these times of real challenge that free clinics shine.
Through our agility, our creativity, and our adaptability, free clinics have demonstrated an unwavering commitment and dedication to our patients.